We are going through a profound demographic shift in our country, and with this shift comes opportunities to overcome a host of obstacles that are preventing our nation's seniors from aging successfully.
And it feels like it's just starting to enter the collective consciousness that the population really is aging, that the way we've taken care of people until now will not be sustainable.
We're doing things in San Diego that no other group is doing in the country, and we're excited about disseminating our learnings once we've collected data and we're able to prove that these are better forms of care for our seniors. So our work at West Health is divided into 3 primary pillars. The first is acute, the second is chronic, and the third really deals with long-term supports and services and the importance of community-based organizations. In our acute portfolio, we have a host of partners, and a flagship project would be the Geriatric Emergency Department, which we are launching with UC San Diego Healthcare System.
We love the idea of how to create an environment where we could take care of seniors, how to put together the right sustainable clinical model, and then creating the runway for the future through clinical and translational research. And in a really short amount of time from there, all of a sudden we have access to this consortium that West Health has helped put together, where we have world-class physicians who are building this across the country.
So a very good example of that is our work with a national collaborative called the Geriatric Emergency Department Collaborative.
I think it's shocking that individuals trained to work in healthcare in general, including the emergency department, don't currently receive extensive specialized training in the differences in older adults and how to take better care of them.
If emergency departments can be better informed on how to provide that care through the collaborative, my hope is that we'll not only impact and shift the needle in terms of better care for the aging population, but for many generations to come.
Because of West Health, we all get together, meet frequently, and share best practices.
But as you know, as we age, it's not just the acute events. There's broader health and healthcare needs that we have, more chronic needs.
It's no surprise that most seniors are living with no less than 5 chronic conditions, and managing those chronic conditions can absolutely be done outside of the 4 walls of a hospital.
So that's the target population for home-based medical care. So these are the people who are costing Medicare excessive amounts of money.
Change is hard. Systems like to maintain themselves. They can't just cut costs. They have to think about how they're deploying their resources to get the best possible quality at the lowest possible cost. And to do that, they've got to look at creative solutions. And this is the kind of work that West Health has been working on, and the John A. Hartford Foundation is so proud to be a co-partner in all of this.
Measuring outcomes is absolutely critical. West Health has recently partnered with Johns Hopkins and UCSF to develop and stand up a QCDR, a Qualified Clinical Data Registry, that will enable us to measure the outcomes associated with this model of care.
Our final area is long-term supports and services and community-based organizations.
So as we look at partnering, we really look for organizations who are prepared to think and act differently.
Community-based organizations like Meals of America and other stakeholders that are interested in helping seniors.
We have an army of 2 million volunteers across the country who knock on people's doors, deliver a nutritious meal and a friendly visit. What we want to do is, working with different Meals on Wheels programs across the country, understand their different approaches to what happens once they knock on the door and deliver the meal. That volunteer, or even a paid driver, can raise a red flag. So the idea is that working with healthcare entities or insurance companies to be able to say, we've noticed a change, and we want to avoid catastrophic health events that cost our system a lot of money. This may be one of the first projects that is also cross-organizational with West, that the Foundation, West Health Institute, and also we've been working with West Policy Center in Washington, because we don't want just great research that doesn't move the needle. What we'd like to do is work with the Policy Center to see how we can take this research and help motivate folks on Capitol Hill to change policy and legislation.
And that course will take us into years to come with a focus on this population that's vulnerable.
So as I've collaborated with West Health, it's very clear that they're all about trying to find solutions, and they're all about trying to scale those solutions. And they try and find the right collaborators.
It's something that we hope we can shine a light on here at West Health through actually making it a little bit easier to age in place, to age with dignity, to age in the community that you love.
It's critically important. It's critically important for seniors and their families and for communities across the country.